Hello, I'm Sarah Burns and I'm responsible for planning many of the health and care services that are delivered in County Durham. We last spoke to you in 2019 about the services that are currently delivered at Shotley Bridge Community Hospital and the development of a new facility. We talked to you at that point and your views that you shared with us helped to inform our future plans. We'd like to talk to you again about the services we think could be delivered from a community hospital in the Northwest Durham area. We know that the population is growing in Northwest Durham. We have a growing elderly population and many of those people have multiple long-term conditions, and we need to plan health services to meet the needs of our population. We work in the integrated care system across North East and North Cumbria and collaborate on delivering health and care services where we need to, but most of our work happens at place in County Durham. And NHS County Durham CCG is working closely with County Durham and Darlington Foundation Trust, who is the main provider of health services in Northwest Durham, to plan delivery of services from a community hospital in that area. We've been working on this project for a number of years. Many of you will have been involved in public engagement that took place between March and May in 2019. We had over 1,300 responses from you, which was fantastic, and they helped us to shape the model of care that we're proposing today. Since then, the country has experienced the COVID-19 pandemic. And we've reviewed the services and our clinical model based on learning from COVID-19. And we've been re-looking again at our proposals since November of last year to make sure that they are fit for purpose. It was announced that the Northwest Durham Community Hospital project would be one of 40 hospitals nationally that would receive government funding. An indicative budget of £30 million was confirmed in January 2021. We now want to engage with you on the proposed service model during February and March of this year. We want your ideas on the services that we propose are delivered from this new facility. Health and care services are delivered from a range of different settings across County Durham and the North East. Specialist centres like Newcastle Hospitals and James Cook deliver specialist services for trauma, cardiology and neurology. General hospitals like the University of North Durham deliver a range of services including A&E, critical care, acute medicine, maternity, outpatients and diagnostic services. Community hospitals are delivered right across County Durham from places like Shotley Bridge, Chesley Street and Weardale. They provide care closer to home for both unplanned and planned care from a range of different specialties: outpatient care, inpatient rehabilitation care. Some of the challenges that we have in delivering health and care services we've already mentioned. We have a growing population, and that population has a range of comorbidities or long-term conditions. We have inequalities in care. Demands for health and care services are growing, and we also have new housing developments in Northwest Durham. In terms of the estate or the building that services are delivered from, needs to meet a range of criteria. They need to be accessible, need to be able to realise the potential of a community hospital in the local area, and there need to be good transport networks. And for the health and care system, we need to make sure that we deliver joined up care, that we don't have duplication where it isn't necessary, that we make the best use of technology where we can, but we also make use of our greatest asset, which is our NHS workforce.
My name's Jeremy Cundall. I'm the Executive Medical Director of County Durham and Darlington Foundation Trust. I'm going to talk to you about the clinical vision for the Shotley Bridge Community Hospital and what we aspire to provide for the community that we serve in the future. We need to reduce health inequalities, deliver care around the person and their needs. We need to get things right for the future generation. This is not a short-term project. This community hospital will be there for a number of years and decades to come. We need to deliver the care as locally as we possibly can, and we need to use innovative technology to provide that care. So if we look at what we're aiming to provide, outpatients services proposal, there will be outpatient services at this community hospital as there currently are at the Shotley Bridge site. We would look to be able to provide audiology, ophthalmology, cardiology, dermatology, diabetes, ear, nose and throat, respiratory, retinal screening and trauma and orthopaedics. We also would like to offer outpatients for both normal outpatients and also women's services. From a women's services point of view, we will look to deliver antenatal and postnatal assessment, colposcopy and sexual health. Chemotherapy is really important, as one of the outputs from the COVID pandemic, we look to provide chemotherapy off-site from our main sites of Durham and Darlington. This means that chemotherapy will be delivered at Bishop Auckland and Shotley Bridge. There will also be a dedicated medical investigations unit looking at providing plain X-ray, ultrasonography and echocardiography. We will not be providing endoscopy or telescope tests at the Shotley Bridge Hospital. We will also be looking to deliver a range of therapeutic services at the site, including physiotherapy, occupational therapy, podiatry, orthotics, dietetics, and speech and language therapy. As I've said, the medical investigations unit will be placed at the Shotley Bridge site, as well as diagnostics. So there'll be ultrasound, X-ray and echo. There'll also be an urgent care centre. That urgent care centre, following consultation, will be a 12-hour offering. So it'll be between 8 AM and 8 PM. Overnight, there will be a local service provided by a mobile unit. This will be a much more adaptable and proactive offering for our local communities. It's also important that we have local rehabilitation and step down and step up beds for the community. We propose to have a 16-bedded rehabilitation unit, which will act as a step down from the acute hospital and also enable primary care to step up where patients need a short period of respite to meet their needs. One of the things that's come out of the pandemic is that Shotley Bridge as a unit will be very well placed to provide minor surgery. And specifically, we're looking at dermatology, so skin and plastic surgery, under local anaesthetic. As I said in the previous consultation or a previous engagement process, we did not plan to provide general anaesthetic surgery at the Shotley Bridge Hospital, but we have provided and would like to continue to provide local anaesthetic based surgery on that site. So here's in a nutshell, the proposed clinical model. You've got the acute hospital and you've got the general practice, community, primary care and social care in the voluntary sector. And then sat in the middle will be the community hospital at Shotley Bridge. There'll be an urgent treatment centre, there'll be a range of outpatient services, and there will be community rehabilitation beds.
The project is one of 40 hospitals in the government's recently announced hospital building programme, with a capital sum of £30 million allocated. Since the last period of engagement, the proposed size of the building has increased with the inclusion of 16 beds, a medical investigations unit, and an increase in the number of chemotherapy bays. With an area of around 5,000 metres squared, A site of between 3 and 5 acres would be required for any new building, and we have undertaken a search for available land within 3 miles of the existing hospital. Initially, a long list of 14 sites were identified for consideration. However, many were either not available for purchase, had constraints on space or access, or would have had difficulties in obtaining planning permission. Following a further detailed appraisal and discussions with the local authority on planning and highway matters, 8 sites were ultimately shortlisted to 2. Those sites being the existing Shotley Bridge site, and it's important at this point to say that a new build option on the existing site is not feasible because of the space constraints and the need to maintain car parking and clinical services during what would be prolonged periods of construction and demolition. We have, however, demonstrated that there is the possibility of refurbishing part of the hospital to provide the services we need. The second site is the Genesis site, which is a development site near the Hermiston Retail Park and the A692, which obtained planning permission in February 2020 for a multi-use development, including a healthcare facility. The business case, which is now in production, will consider each option to determine whether it can deliver a modern state-of-the-art facility for the local population for the next 20 or so years, if it offers value for money for the taxpayer, and if it is affordable both in terms of the available capital and on a recurring revenue basis. So what happens next? We are hoping to complete the outline business case and have it approved by autumn 2021. Then complete a full business case by spring 2022. If all goes to plan, construction could start by the summer of 2022 and the new facility would be operational by early 2024. Assuming both options provide exactly the same clinical services, what are your views on the 2 options? A refurbishment project on the site of the existing hospital, or a new build hospital on the Genesis site? How easy is it for you to access either of the sites? How important is it to have other amenities close by? How important is it to have a new modern design as opposed to a revamped existing building? Also, as we start to enter the next stage, if you want to become involved in helping with design development, you can leave us your details. You will be able to provide this information as part of the online survey.